Ready or not, tomorrow Obamacare insurance exchanges are open for business. What do you need to know about your coverage options? FoxBusiness.com reporter Kate Rogers is here with more. Okay, so everyone has questions. Ready or not, like it or not, tomorrow's a big day. So October 1st, can you start enrolling online? What does everybody need to know?
Absolutely. So tomorrow kicks off open enrollment period, and this lasts for 6 months through March 31st, 2014. So every American that isn't currently insured should go to healthcare.gov and they can start looking around for a plan that works for them. If they choose not to buy coverage by the end of this period, they will be subject to that $95 penalty per year. But it's important to note, if you sign up tomorrow, your coverage doesn't actually kick in until January 1st. So some people might want to wait a little bit longer before they sign over that check.
And some of the online glitches are going to be worked out in the meantime, right? Like the language, Spanish language option is down for 2 weeks, I heard.
Exactly.
Okay.
So on healthcare.gov, you can find out if that impacts you at all, but definitely go tomorrow and start shopping around.
Okay. What if employers offer insurance today?
Employer offers coverage because essential minimum coverage, and it's government approved. But it's important to note, if you do choose your employer's plan, you can't go for a government subsidy to lower your premium because you're getting it through your employer and not through a state or federally run exchange.
Okay, so you're opting out of the government program if you're choosing the one through the employer, correct?
Yes, exactly.
So what kind of coverage are we talking about? What's going to be available to the average person when they look at the calendar?
When you go to these exchanges, there'll be different tiered plans, everything from bronze all the way up to a platinum plan. But every plan now has to include these 10 essential health benefits. And those are things like maternity care, prescription drug costs, ambulatory services, all things like that will be included in the new plans.
Let's talk about costs. What's this going to cost the average person?
Well, of course, costs are going to vary across the board. The Department of Health and Human Services came out last week and they said that for the average American, an unsubsidized plan per month would be about $328. Now, those who are making up to 400% of the federal poverty level will be eligible for subsidies under the new law. And for an individual, that's about $45,000 a year. And for a family of 4, that's about $94,000 a year. And those subsidies will help lower the cost of their monthly premium. But before those subsidies kick in, and not everyone will be eligible for one, the average monthly cost will be $328.
Sure, and a lot of people are facing average costs going up as well. What if someone misses that March 31st deadline?
So if you miss the deadline, you will be subject to the $95 penalty per year. But if you have a major event in your life, like a divorce or a serious illness, you can file paperwork with the government to get your personal open enrollment period pushed back so you won't be subject to that penalty.
Okay, so there's a little flexibility on that back number then. Okay. Kate, thank you so much.
Thank you.
Practical information, whether we are ready or not.
Yes.
Thank you. Coming up.